Hi, everybody. Hi, everybody. Welcome to today's Research Alliance member webinar on the eve of Labor Day. Hard to believe that the summer is coming to a close. Thanks, as always, for joining us and for your partnership. Today, we are really happy to be joined by Dr. Carrie Wolinetz, who serves as Deputy Director for Health and Life Sciences in the White House Office of Science and Technology Policy. Carrie is going to speak with us today about the exciting work OSTP is doing in the life sciences beyond ARPA-H. And for those who aren't familiar with Carrie, she has touched a number of key Research America stakeholder groups in her career, most recently at NIH as Acting Chief of Staff and in the Office of Science Policy, and before that, helping to lead federal affairs at AAU and other roles that I'm probably not even aware of. But Carrie, we are so pleased to have you today. To our audience, as usual, please type your questions into the Q&A box or the chat box as we go along, and we will ask them for you when we get to the Q&A portion of today's meeting. And with that, let me turn it over to you, Carrie.
Excellent. Thank you so much, Jenny, and thank you, Research America. As Jenny mentioned, I've had the great pleasure of intersecting with Research America and the work that they do throughout my career, from my early days as a policy analyst at FASIB, all the way up through my roles at NIH. So it's really exciting to be able to talk to you today. So if we could launch right into the slide deck, please. So it is a really interesting and unique time to be at the Office of Science and Technology Policy. And I'm not just saying that because I'm biased, because I happen to currently be at OSTP. But if you've had an opportunity to read the president's letter to the OSTP director, Dr. Eric Lander, and if you haven't had a chance to do that, I encourage you to Google it. Although with this audience, I expect you're all well versed in it. Just to note a couple of really historic moments for OSTP. First, the president has elevated the OSTP director role to that of a cabinet level position, which really reflects the Biden-Harris administration's commitment to listen to science, which is something that they've talked about, particularly in the context of the ongoing COVID-19 pandemic. But also, this letter, I think, reflects a unique intersection of OSTP and health and the life sciences. First of all, Dr. Lander is the first life scientist to lead OSTP as one of the pioneers of the Human Genome Project. As I am sure you all know, OSTP has typically focused far more on the physical sciences or very specific intersections with the life science, whether that's specific topics like the microbiome or intersections with national security issues, for example. But Dr. Lander's appointment really reflects what you see in this letter from the president, which really lays out a vision and a set of marching orders for OSTP that we really use as our framework for everything that we do. The president invokes Vannevar Bush. If you are a science policy nerd like I am, you know that Vannevar Bush, of course, was President Roosevelt's science advisor, and he really laid out in his report, Science, the Endless Frontier, the framework of science policy that we are still living in this country today. And so in invoking Vannevar Bush's report, the president really asked Dr. Lander and OSTP to lay out a vision for the next 75 years of science policy, and asked a series of provocative questions. And what I want to point out about those, if you read them, is the word either health or biology appears in every one of those paragraphs. And that is reflective in the formation of the new division, which I lead, which is the Division of Health and Life Sciences, which is a first for for OSTP to be involved in. And just for folks who we're still in the process of putting out an org chart, but if you've been following the Office of Science and Technology Policy, you're aware there are a couple of new divisions, which I think do a nice job of reflecting our priorities. The Division of Science and Society, which my colleague Dr. Alondra Nelson leads, our Division of Climate, which Dr. Jane Lubchenco leads, and then of course we have our National Security Division, which Dr. Jason Matheny leads. We are sort of the deputy directors of OSTP, and again, reflective of a lot of the priorities that are laid out in this letter. So next slide, please. So what the heck does all of that mean? What is the Health and Life and Science Division at OSTP working on? We've got a lot going on, and I'll tell you where the majority of our bandwidth is spent, practically speaking, because we're a new division. We are in the process of onboarding people and getting organized in a lot of ways. But we do have a set of priorities that we are thinking through and keeping in mind. And all of these, not surprisingly, really stem directly from that blueprint laid out in the letter that the president sent to Dr. Lander. And I want to emphasize that in everything we do across OSDP, and certainly in the Division of Health and Life Science, we're really keeping equity as a overarching lens through which we are seeing everything. We are quite committed as part of the Biden-Harris administration vision to ensure that equity is not just a word that we use, but is really something we think about, whether that's in thinking about health equity or workforce equity or equitable access to all of the innovative products coming out of life and biomedical science. And so we are constantly reminding ourselves that we really need to make sure that every time we think about a question in terms of life science policy, we're also thinking about where the intersection with equity is as well. But to give you a sort of broad brush stroke of some of the priorities and topics that we're addressing or plan to address in health and life science, biopreparedness, particularly pandemic preparedness and pandemic readiness, antimicrobial resistance. I'm going to say more about that in a moment, so I'll just leave that there. Something that the president specifically mentioned in his letter was health equity and thinking about how we integrate equity and improve our public health systems, our health systems to move towards health equity. How do we build on the lessons, good and bad, that we learned about during the COVID-19 pandemic? Including thinking about the prospects for telemedicine and community healthcare, expanding on the knowledge base of electronic health records and all of the work that has been done, particularly by our colleagues at ONC, and addressing some of the issues that clearly came to the fore in our public health system as we dealt with the ongoing COVID-19 pandemic. Another big area that we're thinking a lot about is how do we accelerate innovation to patients? The sort of Keystone Initiative, which I know you've already heard a lot about, so I won't spend a lot of time on, of course, is the creation of a new research agency within NIH focused on a DARPA-like model of advanced research for health, specifically ARPA-H. And then of course, it is not a secret that the president and the First Lady care a lot about cancer and the progress that we're making at cancer. The president talks a lot about ending cancer as we know it. But really, we're taking a lot of that model and thinking across the spectrum of diseases that impact human health, and how can we take some of the lessons learned from the previous cancer moonshot and build upon them and expand them, excuse me, not just in the cancer arena, but across a knot of medical issues. And then, of course, thinking through how do we continue to improve upon the clinical trial enterprise And some of that, of course, is built into our pandemic preparedness response. We're thinking a lot about biomanufacturing and the bioeconomy, and how do we make sure we're preparing to build for the life science industry of the future. Although I come from NIH, and right now a lot of my team comes from NIH, we recognize that life science does not mean biomedical science. And so we're thinking about agriculture, in particular nutrition, and then of course across the life science enterprise, particularly on the workforce issue, we're partnering quite a bit with our colleagues in science and society, and thinking about how do we ensure a diverse and prepared and equitable life science workforce that is set for the future of the life sciences. And in particular, are there opportunities to improve doctoral education? But of course, health and life science is a big bucket, and there are a lot of other topics that are crossing our transom, or we're in midstream or intersect with other things going on across the White House, or across OSTP, everything from maternal mortality to addressing the opioid crisis, to thinking about what the horizon of artificial intelligence and machine learning and its intersection with healthcare is, to emerging biotechnologies. Really, the number of potential issues we could get involved in is long. It's going to be a matter of prioritizing what is really actionable in terms of near-term opportunities and challenges for the future. So next slide, please. And so I mentioned the vast majority of our time right now, it probably won't surprise anybody to know, if you saw Dr. Lander's op-ed recently in the Post, is really working through plans on pandemic preparedness. A lot of this is done in close association with our colleagues in the National Security Council, and thinking through how do we make sure that we are ready for the next pandemic. We have every reason to believe that unfortunately, due to climate change, due to the trends in emerging infectious disease, that it is likely we're going to see pandemics with greater frequency, whether those are naturally occurring or as the result of deliberate or accidental release of microorganisms. And so we want to make sure that we have all of the capabilities in place to be able to identify, detect, and respond quite rapidly to those pandemics. We've learned a lot of lessons from the current and ongoing COVID-19 pandemic. And the good news is, from a science and technology point of view, the ability to be able to set and achieve really broad goals, such as coming up with a vaccine within 100 days of a potential pandemic pathogen first being identified, are within reach. It's really just a matter of continuing to improve and build on those capabilities, and dedicating the resources and national and international will to those goals. So stay tuned. You'll be hearing more about our plans on pandemic preparedness very soon. Next slide. And then, of course, I know you've, as I mentioned, heard from my colleague, Dr. Schwetz, on this issue, so I'm not going to spend a lot of time on ARPA-H, but of course, this is a opportunity that is of high priority to the president. It's something that he speaks about regularly, publicly, this idea that we will be able to really catalyze health breakthroughs using a different model that is complementary to our traditional research model, either within the public or private sector, within NIH, to bring a DARPA model that makes sense for health, and really be able to seek innovative solutions to some of our most difficult problems in health and medicine. And so that is something that we are also spending quite a lot of time on. Next, please. and perhaps most importantly, is what I am beginning to do right now. So we recognize that the White House is certainly not an island, and that's true of OSTP. We really are interested in hearing the best and brightest ideas from stakeholder, from really being able to get feedback on some of what we're thinking about, and are looking for opportunities, as you've seen with ARPA-H, as we will be doing in the near future on pandemic preparedness, and all of these other topics that I mentioned are on our list, to learn from and engage with stakeholders within the health and life sciences about where really the White House can create opportunities. It sounds very simplistic, but a lot of times, when I'm talking with Eric Lander and we're brainstorming over what we can do, we really start from the basics of, what is the ideal state? What is the world that we want to live in? What are the problems that we really think we could have an opportunity to solve? And then we think about, how do we get from point A, where we are right now, to point B, as near to that ideal state as we can. And that's where it's really helpful to think through our ideas with stakeholders out there in the community, and work closely across the U.S. government with all of the terrific research agencies and health stakeholders across all the U.S. government agencies. So final slide, please. So with that, I am happy to take any questions, which I'll do my best to answer. I will say I find myself using the phrase a lot, building the airplane while we're flying it, when describing our activities at OSTP. We are, of course, a nascent division within a new administration, and so we are working and putting things together in real time. So have patience with us as that process rolls out, but appreciate the opportunity to come and talk to you today.
Thank you, Carrie. Thank you so much. Feel free to stop and grab a sip of water while I ask you my question, and then we'll go into audience questions. Well, first of all, I just think you're such an ideal person to, not to fangirl too much, but you're an ideal person to be in that role. And as you said, building the plane along with Dr. Lander and others. How does the federal pandemic response look to you sitting in OSTP versus NIH? Are there parts of the federal government that could be better coordinated? I don't mean to call out particular agency names, but you must be looking at it very differently now with a sort of a whole of government hat than you were in your previous role.
Yeah, so OSTP has been less engaged in the current response. We are the sort of division. We've got the COVID team, of course, which is quite capably led within the White House by Jeff Zients, and we've got the National Security Council, who's quite involved in the response. So, in sort of a divide and conquer mode, we have been focused on sort of the forward-leaning, thinking about readiness for the next pandemic based on the lessons learned here. I guess I'm a glass half full kind of gal, as you know, Jenny, for working with me for a long time. And so I have been thinking a lot about all of the positive lessons we've learned about coordinating across the federal government during this pandemic, that we can really build on and expand for the future. And I think it's really easy to focus on the places where coordination didn't work so well, or things seem to fall down. But there are also a lot of really great examples of things that worked really well in that space. The rapid stand up of the active partnership at NIH, of course, was something I know well because I got to witness it in real time. The coordination that took place across Operation Warp Speed to develop vaccines. And so I think we're spending a lot of time thinking about how do we take those lessons and really put mechanisms in place to build on them for the future. And I think there are a lot of opportunities to do that.
That's great. Well, we agree at Research America. As you know, we've been very active in the Science Technology Action Committee and the action plan, which calls for a big boost of resources to OSTP to play that coordinating role. I wanted to ask, and you may not know this yet, but if there are new authorities that OSTP needs to play this coordinating role and to get into some new of these areas, we'd certainly be interested in helping.
Well, we appreciate that, and I'm going to avoid any, of
course,
any ethics issues by speaking to that more specifically. But I think, certainly having Eric Lander at a cabinet level role gives OSTP, a seat at the table that has never been seen before. And, we are trying to be very thoughtful of thinking how he uses that seat at the table in a way that really helps support the science and technology mission of OSTP.
Thank you for mentioning that. I should have mentioned that at the top. I mean, that's just an enormous step up for science. So I'm going to turn it over to Terry now for audience questions.
Yes, thank you, Jenny. And just a reminder to folks watching, you can go ahead and submit your questions by clicking on the Q&A button at the bottom of the screen, and we welcome your questions. One question that's come in is that mentions Japan and how they have approved vaccine strategy as a cabinet level decision and planning to establish an R&D center for infectious diseases. Do you think the US's pandemic preparedness plan will work cooperatively with Japan, or do you have other plans related to international collaboration?
So I can't speak, specifically to plans in cooperation with Japan on pandemic response, but I will say, in general, something that I have grown to appreciate coming from NIH to the White House is just how much international collaboration, goes on literally a daily basis. So you probably saw, in the press that Dr. Lander has been working quite closely, in conjunction with the bilateral discussions going on with the UK with his equivalents in the United Kingdom, Sir Patrick Vallance, who's the science advisor to the Prime Minister in the UK. We're planning a UK-US Cancer Summit, for example, as part of that partnership. And we've been collaborating quite closely with the UK on pandemic preparedness. But that's just one example. Truthfully, those of us in OSTP are frequently up at all hours of day or night to accommodate time zones across the world to really stay in touch with our international partners and learn from each other. And we've had discussions with a number of international partners related to ARPA-H and pandemic preparedness. So those interactions are frequent and ongoing and generally positive, and well beyond OSTP, I should say. We are one small piece of a much broader executive office.
Great. Another question. Will your division be making recommendations to other agencies going forward, or giving grants to stimulate certain activities? How does that fit into OSTP's role?
So we don't have grant making authority. So let me start with the easy one. I feel like I've actually been a privileged place throughout my career in that I've never really had the ability to give out money. And there's something quite nice about that, actually, in terms of being able to think through policy. But we certainly, we think through all of the tools at our disposal, when we're thinking about how the White House engages, whether that are interagency process processes that occur through the National Science and Technology Policy, whether that is engaging with the President's Council of Advisors on Science and Technology, PCAST, which will hopefully be stood up soon to make external, bringing experts to make recommendations, whether that's working through, executive orders, or, a recent example, actually, as you may have seen, there was a joint OSTP, OMB memo, that essentially set some high priorities, such as pandemic preparedness for the U.S. federal agencies. So there are a number of ways in which, OSTP both informally and formally engages with agencies to coordinate or guide activities.
Great. And so jumping back to the international question for a minute, we've had another question. Can you talk a little bit about the goals around, and is there anything around fostering science and technology capacity in low-income countries related to pandemic preparedness, and also fostering new markets? Is there maybe a role for the Fogarty Center in this going forward?
So certainly nothing specific that I can speak to, but particularly in the conversations, my colleagues kind of across the government and the State Department and the National Security Council, access in low and middle income countries is something that is, always at the fore of the discussions, particularly in the context of the pandemic. And it is certainly something that we think about from a global perspective. Again, when we think about equity, there is equity within the United States, which we're certainly committed to, but we also think about equity in the global health sense as well.
Carrie, I think I'll just step in just to clarify something. Carrie, you mentioned the memo from OSTP and OMB regarding pandemic preparedness. Are you referring to the very recent memo to federal agencies regarding their FY23 budget submissions?
Yes. Yeah, that's right.
That's right. And that is publicly available. We can send that if folks are interested. But that memo itself, Carrie, I think really reflects this whole of government approach and this focus on really cross-agency collaboration. That's going to be so important for the priorities. I wanted to ask, with a social scientist for the first time as a deputy director, do you see the social sciences playing a role, the behavioral sciences in particular, playing a role in issues such as pandemic preparedness and AMR, for example, where human behavior really will affect the outcome of whether or not we're able to be successful?
Yes, absolutely. And let me just say, I feel incredibly privileged to be able to work with Alondra Nelson, who, if anyone has the opportunity to interact with her, she's just truly an amazing human being and scholar and thought leader in every possible way. And so first of all, with Alondra sitting next to me at the table, there's very little danger that social science and behavioral science and thinking about the intersection of the social sciences and equity isn't going to touch on everything that we do. But Alondra's been spending a lot of time actually thinking about exactly this question of, how do we ensure that we're not just thinking about the sort of science and technology pieces, but also all of the supporting social pieces that go along with that? So as an example, thanks to Alondra's influence, every time we talk about the 100-day vaccine goal that, the UK sort of led the CEPI, which is the Coalition for Epidemic Preparedness, a vaccine group, and the UK put out there in the context of the G7 discussions, and the US has welcomed and is building on that vision. I remind folks that it would be a terrible tragedy if we hit our audacious goal of, a vaccine in 100 days, and then we couldn't get anybody to take that vaccine. That would be the worst possible scenario. So we need to, start early and often, including to address the current pandemic, to really think through how do we learn from the social science evidence, how do we think through communication and engagement and human behavior and public health practice, so that we have laid a social foundation on which our science and technology advances can come to rest, because it's not an either or proposition. It's really a parallel, interconnected set of issues.
Nicely put. Thank you. Terry, I think we have time for one more question.
Yes, just one more. Do you perceive OSTP as maybe fostering more of those public-private partnerships that have played such a major role in the pandemic response, such as contributing to the vaccine development, but also in so many other ways?
Absolutely. I mean, I think, when everybody, including Research America, I think we're spending a lot of time, even as we're in the midst of the pandemic, thinking about, all of the lessons learned, all of the opportunities and challenges from this really sort of historic events that we are all living through in real time. And I think, some of the public-private partnership stories there are among some of the most interesting and potentially most successful lessons learned from the pandemic. So it is hard to imagine a world where, when we think about pandemic preparedness, just as one example, and I think there are a lot of others, ARPA-H certainly gets into this, where I would imagine that we don't see not just a whole of government effort, but frankly, a whole of society effort to address some of these things. And that's going to have to be accomplished through, innovative ideas for public-private partnerships.
Carrie, thank you so much. We were torn between asking you to stay longer and knowing how much of your time you've already given and what you have on your plate. Particularly given your presentation, but it's just really exciting to see OSTP getting into all of these areas that we've been working on and so many of our Alliance members have been working on. So obviously we stand ready to support your work. We're going to be doing a panel on AMR at our National Research Forum, and really hope that we can also see a whole of government approach to that issue, like we had, under the Obama administration. So thank you again, Carrie. I'm going to make a few quick announcements. So just some housekeeping items. Next week, speaking of AMR, we'll be talking to Dr. Rima Kabaz, who directs the CDC Center for Emerging and Zoonotic Infectious Diseases, where a lot of the AMR work is done. But she'll also be talking about the CDC's role in pandemic response. And we hope that you will attend our National Health Research Forum, which I've been calling our Medical and Health Research Policy Palooza. It's September 13th, 14th, and 15th. We just have an incredible lineup of thought leaders, wonderful conversations, roundtables, early career scientists engagement, etc. So we hope you'll join us. It's completely free. The link is in the chat. And also a plug for the Rally for Medical Research Virtual Hill Day, which will take place on September 23rd. And we certainly encourage everyone to take part in that advocacy opportunity. So have a good rest of the day. Thank you for all that you do. And we look forward to seeing you next week.